Hello everyone, welcome to our McKesson overview. As you can see, we have some of the main points highlighted, but we also have more information for you guys. So founded in 1833 by Charles and John, they were known as McKesson and Company. This company went through several mergers and partnerships before becoming solely McKesson Incorporated in 2011. It is one of the oldest operating businesses in the United States. McKesson is also one of the largest healthcare companies in the entire world, with offices throughout North America, as well as Ireland, Australia, France, and more. But their headquarters is currently in Texas. Now, in 2016, McKesson merged its IT business with Change Healthcare, but dissolved its partnership in 2020. In the same year, in the month of August, McKesson was selected by the U.S. government to distribute COVID-19 vaccines and ancillary supply kits during the pandemic. This company has distributed over 380 million vaccines since July of 2021. Not only does it provide medical supplies, but they work in pharmaceutical productions, as well as being the leader in electronic health record systems. They were the first pharmaceutical distribution system in the United States. Although McKesson started as a drug import and wholesale company, over the years they have branched out to vaccinate people and become a vaccine production and distribution, as well as servicing the implementing electronic healthcare record systems across the entire country and nation. Like every EHR system, there are issues, and McKesson has some. So we are here to talk about the top 3 issues. Like every problem, there needs to be a solution, and these are our solutions for McKesson. The first solution would be that McKesson needs to update their pricing to offer this as a package service. Pricing will vary depending on the type and amount of data that's being migrated from system to system. It should also include what you're being charged for, no matter how big or how small the price may be. The second solution would be McKesson EHR system should be updated to the most current version. This way it is not outdated and will not take long to run at all. There should also be a training class provided for the new hires, since it is a difficult system to learn, and it will go through a course of everything that they need to know, detail by detail, and there will also be a person who's an expert on the system there to assist them if they need more help. And the third solution would be McKesson will need to update its software to offer the ability to allow multiple users to access a patient's EMR data from different locations and to securely share patients' information. So, EMR and EHR software cost a very widely according to the features you choose and the size of your practice. However, on average, you can expect to pay $1,000 per provider per month for McKesson's iKnowMed software, although the prices go up to around $3,000 a month for a full system that includes practice management. So to get the practice management, 3,000 times 12 gives you $36,000 for a year of this system. In addition to the software, you need to make sure you have fast, reliable internet, preferably with a dedicated T1 line, Without the T1 line, the system is basically useless. Since web-based software requires an internet connection as the main source, if you have a decent service but no T1, talk to your telecom provider about installing one so then your whole system can run effectively. Now, however, if your location forbids reliable internet connection, you would want to look at a self-hosted software system instead. These have much higher upfront cost. Web-based systems usually have zero upfront cost, but they don't carry the monthly fee as a web-based system would. Again, prices vary, but on average, you can expect to pay a software license cost between $2,000 and $500 and can go up to $5,000 per user, so per person. Servers start under $1,000 and go up to over $200,000, but they average between $25,000 and $50,000, with an installation will cost around $2,000. These systems do not offer the instant update that web-based systems do, but they do have the advantage of working with or without internet connection. So you're really just going to have to figure out what you want for your company. If you want to have the stability of not having to have internet, but paying more, or having internet and paying just a little bit less. This is the cost of the solution for number 2. As you can see in front of you, this is a step-by-step instruction on how to start up a training class and how much it would cost. And I will give you guys a few minutes to read over the table and do the calculations yourself if you choose to do so. This is our last cost of solution, and we decided to quote a website, but I will go ahead and read it for you guys. Healthcare organizations that need to meet the requirements must develop a new EMR interface. Price is a concern because interface development is a costly project. While CIOs and their teams wish that the average EMR interface price was low and affordable, well-designed interface integrated with labs, radiology, pathology, admin, and practice management are not cheap at all. A simple bidirectional point-to-point interface could cost up to $15,000. On the other hand, a complex multi-channel interface development for full integration could cost more than 12 times that amount. So that could be like $180,000. That is why it is vital to minimize the cost of the interface development without compromising on the quality. We want to thank everyone so much for watching our video on going in depth on McKesson. We appreciate everyone's time and efforts, and we hope everyone has a great rest of your day, and thank you so much.